We are always a underdiagnosed and undertreated population. People tend to oversimplify things and say, I don't need to do it, everything seems to be okay, and if I go there something will come up. It can't happen to me. People don't realize they have blood pressure issues because they have never checked it. And you will see that the solution really at the end of it is transplant. So I think physiotherapy plays such a crucial role in most of these things. Simple weight-bearing exercises is something that unfortunately a lot of Indians don't do, and so much more women don't do. Now, if he starts assuming normal routine work immediately, just because the knee pain is gone, he is bound to damage it immediately.
Right. What do you think the Indian healthcare system lacks? Hello, and welcome to this episode of The Good Life Guide. Today, we have a special guest with us, Niteen, whose career has spanned over both the fast world of investment banking and the transformative field of healthcare. Hi, Niteen. Welcome to the podcast.
Thank you for having me.
Yeah. So, first, we wanted to know that you have had an extensive career in the finance background.
Sure.
What kind of led you to take this plunge into the health industry? Was there like an insight or a data point that was really convincing for you to transform to health industry?
So let me give you a little bit of my background. I come from a doctor family, so there are around 8-10 doctors in my family. So the dinner table conversations growing up have always been around medicine and patients and what have you. I did around 11 years with KPMG's corporate finance group, where we did mergers, acquisitions, that kind of stuff. And my last 5 years was with GE Capital, where we did investments from their prop book. So I've looked at the private equity side a little bit as well as the investment banking. And part of my role with GE Capital was to look at healthcare as a vertical, because GE Health is a very big business. So one of their goals was to look at businesses that make sense to the overall GE portfolio. Right? And whilst I was there, therefore, I started researching a lot into healthcare and what have you. One of the things that I realized was healthcare was probably the last industry to see significant investments coming through, right? And that probably started in the late 90s, early 2000s, and it started kind of flowing through. Till then, there was not much investments per se happening within the healthcare space. And that became stronger and stronger in first decade of 2000 and then thereafter. So that's when I started thinking, as we go into the next decade and more and more people, we are always a underdiagnosed and undertreated population. The economic welfare and the progress was happening tremendously. So people were having and are having more and more funds to look after themselves primarily. So that's when I started thinking through that process a little bit. And I said, 10, 15 years down the line, this is going to be something pretty big.
Right.
And that's really the trigger point for my shift.
Right. Like you said, that India has always been underdiagnosed.
Absolutely.
People don't really go. So that kind of brings me to my next question.
Right.
Over the years, with your experience with Sirona Diagnostics, which tests have been taken the maximum number of times? And the reason I ask this is to understand the issues that are prevalent in the Indian populace.
That is not, it's a no-brainer really. The sugar tests are primarily the most commonly done things, and we are unfortunately the diabetes capital of the world. Right? The other one that we commonly see is the thyroid test being done. And then there's of course CBC and all other guys. But if you look at from a inflammatory and a chronic disease perspective, I think these two would be, your most common things, and it kind of correlates to what you see in the market or what you read, typically going on. Right.
That's so true, because we spoke to a diabetes specialist, and he also kind of said that the Indian market, people are pre-diabetic and they don't even know it, right?
Yeah, absolutely.
So when a person gets their health report, what are the key health markers that one should look for that can help them indicate potential health issues?
I think let's break it down a little bit. I
Sure.
would just say that first, people don't even go and do their routine health checkups
Right.
first, right? So I would first say don't even bother so much about that. Just make sure that you're first doing your regular health
Got
checkups.
it.
Next, whilst I am a diagnostic, I don't want to get into what all different tests you need to do. I'm keeping it very simple. Do your routine health checkups, not anything fancy. Do your routine health checkups. If there is any changes, abnormalities in it, I think that's a good enough start for you to start figuring out, what to do next. What happens most of the time is people tend to oversimplify things and say, I don't need to do it. Everything seems to be okay. And if I go there, something will come up. So I'm better off not going it till there is a problem. And that seems to be a general trend when I see
Yeah.
patients come
Yeah.
in. So I would just say, go do your things. Your CBC is a good place to start with. Your sugar things are good to start with. Your lipid profiles are good to start with. Your renal profiles are good too. And of course, your kidney and liver. So those are your basic things, yeah, right? Your main organs, your main functioning of the body. Do a routine ECG to make sure that your heart health is normal, and that kind of gives you an overall stability. You don't need to do any fancy tests or any expensive tests per
Right.
se. If you just do that much, that gives you a very, very good line of sight in terms of where your health is headed to.
Right.
Yeah.
And these would be the same for people in different age groups. Like if I were to ask you,
Absolutely.
yeah, if
You
someone
can
30
you
plus,
can add a layer. So if you're a cancer survivor, then there might be
Got
different tests. If you have cancer history, you might have different tests. If you have heart issues, then you want to do probably a stress test or something more
it.
than that. But on an average, for a regular person, these tests seem to be more than sufficient. What happens is people miss these tests, saying that it can't happen to me, right? It's like a perfect syndrome we all have. It will never happen to me. It will always happen to somebody else, and that's when problems start. So you should probably do. It's a very good idea to do at least a basic level health check on an annual basis.
And what are the health markers that they should look for in these reports?
Just your it's just simple basic things. Keep it very simple. If you I can give you a laundry list of what the fanciest of tests would be, but from a layman's perspective, it doesn't help, right? Because people will say, why do I need to go and put so much money? So I'm saying keep it simple. Do your sugar, do your HbA1cs, look at your 3 months average, do your lipid profile, see whether your cholesterol levels are building. Do your ECG, make sure your ECG is normal. Do your chest X-ray, make sure there is
and all of this is once a year or twice a year?
Once a year is good. Well, it changes from age profile, right?
Right.
From 30 to 50, we say once a year is good. If you have something that is causing you concern, then it goes to twice a year. But typically, once a year is a good enough thing, right up to, I'd say 60 years of age or so.
Got it. Now, when people are doing these tests, or we hope that they are doing that, what kind of role do you see diagnostics playing in preventive healthcare for early detection especially?
Oh, it's phenomenal what a routine health checkup will throw. I run a parallel company which does regenerative medicine, and I have seen this so many times. People are, like you said, that your diabetologist who came in was told people are unaware about it, and they come to do procedures with us, and they have sugar of 250, 300, and they are completely clueless about it, and then the procedure gets pushed out, and so on and so forth. People don't realize they have blood pressure issues because they have never checked it. So they are very simple things that people get, ECG changes get caught. Nobody knows what is happening within the body, right? And suddenly they do a test, your simple CBC starts throwing up things, right? So that I always say that's your basic starting point for everything, right? And pretty much people can figure out if there's some
Something
some things
wrong.
that you need to kind of get deeper into.
Right.
Your renal profiles, your renal health, your liver health can get tested. So it's pretty good. And then you meet your doctor for a consultation, and then you say, oh, by the way, that day when I was climbing the stairs, I was a little bit heavy
Yeah.
or feeling breathless or whatever that might be, and then that leads to further conversations. But it's these conversations that are important, and at least have that once in a year. So it's
Got it. So it's
absolutely-
just like the body is a machine, and like
Yeah.
every machine, we
Yeah.
also need to
and
get
it's different
checked.
for different person, right?
Right.
It's different for different person. Certainly you say I feel giddy after walking up, and then that will lead to another conversation. So every person is pretty unique in its issues that
Yeah,
they throw
absolutely,
up with.
absolutely. So coming to you,
Yeah.
since you've run a diagnostic setup, didn't you feel like getting into the solution side, say supplements, vitamins, magnesium, because we hear a lot of people having these deficiencies.
Sure.
So did you never feel the need to shift to that?
So we looked at the market from a very different perspective. So vitamins and the supplements get into a little bit more of a pharmaceutical manufacturing side and formulation side, if you may, right? Our perspective was the person walking in the door from a diagnostic perspective walks in the door for two apparent reasons, right? One, from a pure health checkup perspective, or two, he is facing some problem or the other, right? And three, he has identified the problem and therefore wants to diagnose it. So for the first two, what can we do? That was really the question. So when we started trying to figure out what we should do for it, we started thinking through how do we want to therefore see Sirona from a brand perspective, from a person who walks in and wants to, and just how do we want to differentiate in the marketplace? There are so many diagnostic labs, centers, what have you, right? So earlier on, we had decided that we will not get into the CT/MRI business because it's a pretty capex intensive business, if you may. So we have kept it very light from an asset perspective. Therefore, the next question really was, therefore, how do we differentiate? So when it came to that, we said there are 3-4 specialties that in our mind make up around 90% of what typical disease, chronic disease, whatever you want to call it, make up, right? So you have your cardiac problems, you have your renal problems, you have orthopedic problems, and then there is your endocrine problems, right? If you kind of have some sort of a solution for these 4 problems, then you have pretty much dealt with 90% of the issues that somebody faces, a typical household can face. So we went to the super specialist level in that. So we said we should have a cardiologist come into place, we should have a renal specialist coming into our place, we should have a endocrine specialist who would do so on and so forth, and then of course an orthopedic. I missed the one biggest thing, gynec for women issues and post menopausal issues. So these 5 were the things that we therefore started focusing on: women health, heart health, kidney health, orthopedic, and endocrine in general. So anybody who walks in, he gets those services from us as well. So instead of going down, the vitamins and the supplement levels, we said let's look at a solution part of it. So when somebody enters, he doesn't have to go to a hospital to figure it out. It can get figured out, and we get people from one of the best institutions, all the institutions, good institutions, come and do their OPDs at our center. So that's how we kind of segregate.
Yeah, that does make a lot of sense, because you're not only the place where they can find out the problem, but also how to solve it. Because it's like, okay, you go to this diagnostics and then you have to go to a doctor, and then it's too much back and forth.
So it's a one-stop shop, it's something like that that we wanted to. And we do only pure play super specialist things. We don't do, routine, because all of them have that general physicians or a family doctor as a backup. Most of them do. But what they don't have or don't know is where to get a super specialist, where to get a cardiologist, where to get a good endocrine. And we being within the field, we are able to suss out those people and bring them on table.
Right. That's incredible. So moving on to orthobiologics biotech, could you give me a sense of what the offerings are. So I did some research
Right.
and I kind of understood that it's for younger people who have kind of sports injuries and the older people also.
Right.
Right? So which one of those two segments is your segment?
No, so it's an incredible opportunity, and I think in the West and now even in India for that matter, a lot of focus going forward is going to be on regenerative medicine,
Right.
various procedures, stem
Absolutely.
cells, procedures, so on and so forth. If you look at the what should I say, the healthcare continuum or the opportunities or the solutions that one provides. Take your knees, for example, right? So what are the choices one has as far as, treating your knees are concerned? And I'm talking age-related, osteoarthritis-related changes in your knees. Typically, OA knee is graded as 1 to 4, 4 being pretty much the bad side or the
Got it.
and where you really go and need to do your knee transplant or total knee transplant and so on and so forth. So it's the gradation from a good knee to a bad knee,
Right.
and then what do you do with it? And you will see that the solution really at the end of it is transplant, right? Where you kind of pretty much operate and put a whatever processes in it and do whatever is required to be done. Then you do it robotically. But net, it's a surgery, and it's a surgery that you do at the when it becomes really, really bad.
Right.
Right. So what do you do in between? Nothing really. Right. Traditionally, it has been steroids. It has been all sorts of painkillers. It has been a little bit of exercise, physiotherapy, so on and so forth. But the osteoporotic changes per se, nobody is able to figure out how to reverse this. The only thing now that we are coming to see that reverses this is your stem cells, is your regenerative, is your all sorts of regenerative procedures that do this, is your anti-inflammatory, so enzymes that are built into some of these procedures that you do. So that helps regenerate, not just stop your aging process and stop your osteoarthritis, but also help regenerate your cartilage. So that's where we are plugging in, which means that, your grade 2, grade 3, early grade 4, those people who have now facing a little bit of pain in their knees, who are facing a problem on day-to-day activities, can come and get them resolved. And like anything else, if you start early, you are able to increase the, your life of your normal knee, if you may. So that's the big change that is happening today in the marketplace. And you will see a lot more products, a lot more services, a lot more technology being poured into it, a lot more, investments coming into all these things to figure out how do we therefore manage this, how do we therefore rebuild these cartilages and what have you, to start ensuring that there is no surgery required.
Right.
Yeah.
So, coming to regenerative health, could you elaborate on it in a very layman term for our audience who are unaware of what it means or what it does?
Luckily, I'm a layman. I'm not a doctor either. So let me tell you what I have understood, and pardon me if I've from a doctor's perspective if I've missed some things. But so all of us have stem cells, which is commonly known to that help regrow your cartilages, right? We focus on two special things. One is called adipose stem cell therapy, where fat is supposed to be a repository of stem cells.
Okay.
Right? So we kind of, like they do in, they remove your body fat, take 60 to 80 ml of body fat, they process it, take out the process place where it has high concentration of stem cells, and then they inject that in the affected joints, and that kind of gives a release and that kind of helps regenerate. we have a tie-up with a German company who focuses on something called as gold-induced cytokines.
Okay.
So, which is a very special technology, and that kind of helps rejuvenate the joints, and they help stimulate the joints so that the local stem cells start, regenerating the cartilage. So, those are the two therapies that we kind of focus on.
Okay.
And that have given phenomenally good results globally. There is a lot of research papers available on it, so on and so forth. So there's a lot of data available.
Right.
I think what people most of the time misunderstand is these are experimental things. These are not experimental things. These are places where there's a lot of research done, there's a lot of data available, and therefore these things are kind of going on.
Right. So you did say that when you go from 0 to 4,
Yeah.
you use physiotherapy also as one of the techniques to kind of...
Absolutely. That's the first go-to thing, right? Unfortunately, a lot of India is still not focused on physical health, right? Which leads to most of these problems to begin with. So I think physiotherapy plays such a crucial role in most of these things, that if you are doing your strength training properly, if you are taking care of your joints properly, if you are into proper health and physical fitness, some of these things you will never face a problem with, right? But unfortunately, India, as far as that side of the coin is concerned, is still ignorant, or is still not putting too much emphasis on. Simple weight-bearing exercises is something that unfortunately a lot of Indians don't do, and so much more women don't do. And I think that is absolutely critical as far as your overall bone health is concerned, if you may.
Got it.
Right? And that's something that I would want to leave as if there is one message people take, I think that's one message I would want to do, is exercise, do strength training, talk to your physiotherapist, talk to your doctor, get that organized. I think that you will see help take your active life for a far higher percentage than normal people will.
Right. Absolutely. I agree with you.
Yeah.
And what kind of role do you think physiotherapy plays in the post-recovery phase? Is it like complementary with the mechanisms that I use and the medicines that I use?
So look at what the issue is, right? The issue is, and I'll take knee because it's the most abused joint in the system, right? We rely so much upon it, but we don't do too much for it. So if you look at the knee joint, and if you are facing a problem, you start avoiding that knee and you start putting pressure on the other knee.
Yes.
Correct?
And that's very like subconscious thing. You don't even do it consciously. It just happens.
Automatically you start doing, you limp, and therefore. So what will happen as a result of that? One knee gets a lot more attention, the other knee gets very little attention. Therefore, the strength in one knee is going to go down, and you might start damaging the second knee far more than the first knee is concerned, right? Let's assume that the second knee you don't damage because for whatever reason it has the strength and it has the capability. But the first knee that you start limping on, depending upon how long you continue this, starts becoming weak, right? Because you're not using it, right? And we get patients who do this for over a year or more, right? So you can imagine that the knee is so underutilized, and therefore the strength, from a strength perspective, it has weakened and weakened and weakened. And so even if I do the procedure, the pain will release, he will start feeling better. But the strength of the knee is not there. Now, if he starts assuming normal routine work immediately, just because the knee pain is gone, he is bound to damage it immediately. Right?
Yeah, absolutely.
So, without physiotherapy, this is not going to be complete. And people don't understand the reason behind it. And the reason is this: because you have not used it to its optimum, your regular levels, for a fairly long time. So, it is incumbent on you to go and get that strength back, and that's where physiotherapy again plays a huge role. So it's not just complementary; it is part of that healing process. It has to be done.
Absolutely, It's so true. I mean, I have nothing to add because it's so.
But people don't think through that. People come to us and say, "अरे procedure तो कर लिया, अभी क्यों करना है ये सब?" And I keep telling them that you cannot resume your normal thing unless you have got that strength back into your joints. I can clean up for the, I can do the procedure for the pain and I can do the procedure for the wear and tear. But there is no procedure for strength. Strength, you have to do it by yourself.
Absolutely.
So that's where it is.
So my guess is you must have seen a lot of arthritis and osteoporosis cases. If someone with these conditions specifically is watching the podcast, what would be your one piece of advice for them?
So the way we kind of look at it is, if it's earlier on, right, then definitely go to your physiotherapist, figure that out. If it's kind of becoming a routine, obviously come and see us. Our first thing is to see how do we avoid everything. So I think strengthening physiotherapy helps in most of the cases when they are earlier on in the in the degenerative process, if you may. It's such a bad way of putting it, but if it's the early onset of changes, that's the best thing to do, is to kind of start looking at it. And some of these procedures therefore will help not only strength. So physiotherapy helps strengthen this. What we do help regenerate some of the cartilages, so that the effective life of the joint gets pushed out for a far longer period. I think to be very, very what's the right word? Knowledgeable about your own body is important. People say this is what it is, so we'll just wait till it worsens. That's not required. Right? We get a lot of runners who come to us. We get a lot of athletes who come to us because the wear and tear is high, right? And they come and do it preemptively because they know that they have a feeling. That we do their MRIs, we check what their levels are. Some of it might be just sport-related issues, but some of it, if it's osteoporotic, they want to do it earlier rather than later, only because their active life gets extended. We are not saying this will completely remove the need for a transplant later on, because it's a lifestyle issue again. But it definitely, in a lot of cases, pushes the active period of a joint by a fairly longer period.
Got it.
Yeah.
So while researching regenerative therapies for arthritis, I found that it has amazing benefits.
Absolutely.
It also helps healing, helps boost healing after surgery. And in some cases, it might avoid the need of surgery altogether.
Absolutely.
So this kind of very minimally invasive method, how do you think, how beneficial is it for the elders who have arthritis very frequently, who are like the majority of people who have these conditions?
So there are two sets of people, right? That after a particular age, people don't want to get operated. Right?
Absolutely.
So it helps in that section as well. It doesn't help in, or the level of help or the level of pain relief is not as much if it's what we call level 4 osteoarthritic knee or whatever. So in grade 4, which pretty much means the wear and tear is so much that it's bone on bone. There is no in between cartilage remaining. So if there's nothing in between, there's nothing to regenerate from it. So that's really what it is. So it depends upon where you are within the osteoarthritic changes in the body. And basis that we can always suggest, but it's really got to do with that.
So it's basically, even if not the age concern, but it's where you are on that grade is what decides whether you can get this.
Exactly.
So early detection again is the
critical part.
Absolutely. Yeah. So recently I also read that stem cell therapy achieved its first ever reversal for a young woman, type 1 diabetes in
Isn't
China.
That awesome?
It's amazing. How do you see these kind of cases, especially for diabetes, happening in India?
No, we are the diabetic capital of the world. Just think about what it means for, it's type 1 diabetes, but having said which, it's just incredible. It's absolutely phenomenal. And there are a couple of other cases and technologies people are kind of pushing through as well. So we believe that in another, I don't know, 2 to 3 years, this will be, this will be ready to use and consume for people everywhere around the world. And it's absolute game changer. Absolute game changer.
Yeah, I mean, if this works in India, it would be amazing to see. Yeah. But what is the cost efficiency between the minimalist invasive method and the traditional surgery method?
So currently, like in any case, right? Like in any event, when the new technology comes in, it's a little bit expensive to begin with.
Got it.
And as the adoption starts, the technology and the prices keep improving and keep reducing. So there's no question in my mind that it will become, at a price point that is far more affordable than anything around. Currently, the cost of managing diabetes with its complication is just humongous. People are just talking about the medications you take. But it's not just the medication, it's the complications that happen, it's the lifestyle issues that happen, and what happens once the complication sets in. So if you take the complete life cycle of a diabetic patient, it's scary amount of money that goes into it. Vis-a-vis, you're talking reversal here, which means a complete healthy lifestyle thereafter, right? And therefore the so-called complications that arise from being a lifelong diabetic kind of completely goes away from the whole thing. So that's a huge win. So you
even
can't even compare.
in ortho issues,
Yeah.
how do you see, like, if someone has to do, say, a knee transplant or a traditional surgery versus this?
Right.
Even so, if they have to do a traditional surgery, do they have to be at grade 4 or at grade 3 also? Do doctors suggest to kind of?
So it depends case to case basis, right? And how difficult. Sometimes the radiological result may not match with the pain that the patient is kind of suffering. So there are a lot of complications and a lot of nuances once from each and every individual perspective. So sometimes it's grade 2 on an MRI, but when you're examining it might be different. So on and so forth. There is no one size fits all answer for your question really, but question really is, do you want to get operated, cut your leg up, put an alien body part in it and move on? Or do you want to make sure that whatever you have as a natural human being kind of persists and you can work on that? That's really the difference between the two.
Absolutely.
The beauty of most of the orthobiologics treatment is also this, that because it is your own body cells, body tissues, or whatever you call it, given back to you, the rejection, the complications, the problems associated with putting an alien part in your body do not exist, right? So my point is, there's no downward risk to it, right? In an operation, it's always some level of risk.
Of course.
Now, with technology, with capability, things have improved. But an operation is an operation, right? You can't run away from that fact. Vis-a-vis this, while it's a procedure, it's your own blood, it's your own tissue, it's your own whatever given back to you. So there is no negative issue that arises out of it.
Got it.
Like in any procedure, you hear about, surgery is not working out. You might hear every now and then about a procedure not working out, but it is not going to give you a negative result. A surgery not working out, on the other hand, can be a little bit scary. Right? So if you start figuring that out, then and the beauty is, if suppose this doesn't work out for you for some reason,
you always have that
to go back to.
Right. So in the beginning we discussed how your family has a lot of doctors, and you chose diagnostics and you chose this ortho kind of industry to go in. Didn't you ever feel like you wanted to take another route of, say, health tracking apps or AI apps or stuff like that? Because that industry is also booming.
Absolutely.
So what made you choose these two over even the health tracking AI kind of industry?
Well, it goes back to my family really, right? Because these were dinner table conversations. This comes very naturally. This comes very easy. My network within that is
All
so well
right.
said. This is what we talk about all the time. This is what we want to discuss all the time. This is where we see our ability to make change a little bit more easier than anything else. We were not. We looked at a couple of trackers, data,
Okay.
all those things, and we were not sure, especially when it came to medical records and
Okay.
EMRs and all of that. We were not sure what differentiates medical record keeping from one to the other.
Okay.
And with India, storage was becoming cheaper. Services were never really paid for, and nobody really appreciated the need to pay a premium for that
Right.
service, cloud services. So we were not very sure where do we pitch in. Vis-a-vis that, with the technology improvements in ortho, it was a no-brainer according to us. Pathology and diagnostics was the most uncompromised, basic but essential component where we think everything comes out of. So whatever the technological advances, also you will start seeing a lot more in diagnostics. So today we are talking about AI, right? So a lot of MRI readings will now come under MI. X-ray reportings are coming under AI. I was watching a couple of Silicon Valley interviews with some Silicon Valley leaders, and they were saying sooner or later most of the physician roles will be taken over by AI, right? Because it's building up this complex AI formulations to figure out data analysis, which is really what it boils down to. So they are saying that a lot of physicians' roles are going to be replaced by AI. That's a scary place to be, but very interesting and very, very exciting at this point in time. So that's really where we said, whatever it is, this is really something that people can't run away from. End of the day, you need to figure out what your sugar is. End of the day, you need to figure out what your cholesterol is. You need to figure out what your CRP levels are, so on and so forth. So, and as India, another beautiful thing I kind of probably didn't mention to you. So when I used to do, one of the reasons why I again got into healthcare really is being a consultant, we are used to showing these fancy population charts, right? People from 20 to 30, people from 30 to 40, people from 40 to 50. And it looked like a perfect pyramid where you have, which is what the India story was, right? You are workers and young population and so on and so forth. And I'm talking 90s and then 2000s, then 2010. And that lower slab is going up and up and up. But the slab below is not as bigger as the top slab. So certainly now you have a different structure emerging, which also means that another 30, 40 years, you are going to have a very massive old population in India, which India is not, to be honest, geared for, right? And again, orthopedic works beautifully on that. So, so does your diagnostic. So whichever way you kind of slice and dice it, food and healthcare, I think, are perennially going to be, around. So that's really what it was all about.
So coming to the healthcare systems, what do you think the Indian healthcare system lacks in comparison to, let's say, Singapore, which currently ranks #1?
Right. I've been often asked that question, and it's a complex question, to be honest. And I don't think there is any straight answer to that. And the reason to this is you need to appreciate for India for what India is, right? And you can always say, listen, this is what is happening in Europe, and this is what UK is, and the UK system sucks in this way, and India, but UK is still this and that. But India is what, 1.4, 1.3 billion now? there is no place on earth other than China which has that kind of, population to deal with.
Right.
And the complications that arise from that are unheard of and not witnessed by too many people. So you want to manage small part of Bombay and small part of Delhi, which would be equivalent to, I don't know, Singapore population or what have you. It's a easier fix and an easier solution you're asking for.
Right.
But
Okay.
at the same time, your ability to treat complex diseases at a fraction of a cost for a layman is not what a Singapore system would be able to do. So if you just look at the procedures that we do, and these are all, so most of these guys from these big, smart, fancy government institutions that come out, they are extremely well respected because they have that kind of experience and they are well respected globally. So these hands are so well experienced in treating some of these diseases and these surgeries that they are unparalleled in terms of their capabilities. So I don't think it's a fair question to ask, how do we become similar to Singapore? We all want to become similar to Singapore, but Singapore's problems are very different than India's problems. So we cannot come back and say, how can we not have? I think we need to find a solution for ourselves in terms of how do we keep growing. And I think a lot of initiatives have been taken in that regard, whether it is increasing the number of AIMS in the country, whether it is increasing the number of medical seats in the country. End of the day, you need more people to answer, be able to, so it's always how many doctors per 1,000 population, right? And for the longest time, the number of healthcare institutions in the country were not increasing. So however you expected to have more doctors practice and how treat more people and reach out to more people. I think government is kind of answering that question very, very logically. Investments are coming into the field very, very logically. So the spread and the ability and the capability is now spreading from just having, look at Tata Cancer. There was only one location through which they were serving. Now they are placed all over the country and growing. So, and that is only possible provided you have capability as well. So you need to get doctors who are capable, who will be able to go to different places. And that is possible only if you have infrastructure to support that. So I think the government is doing a lot more in it. It's not, an easy fix that you can go to. So I think you will see in the next 10, 15 years a lot of changes happening in that phase.
Let's hope we see good changes happening. So coming to our last question. Our podcast is called The Good Life Guide.
Right.
So we need one tip of the day from you for anyone who's seeking a good life of happiness and peace of mind.
Exercise. So a little bit for your body, physical body, a little bit for your mental health. I think whether it's meditation, whether it's just a calm walk in the woods or whatever, in the roads, wherever, what makes your mind calm. But that plus a little bit of physical exercise, I think that's really the mantra to go to.
Yeah, I think that's perfect.
Yeah.
Thank you so much for being on the podcast.
Always a pleasure.
It was a pleasure. Thank you so much.
Thank you.